Menopause is actually one day that marks 1 year of no periods.
Wait, what?
Where do you see perimenopause starting?
We see an increase of risk for Alzheimer's and dementia once women reach menopause.
Talk to me more about what is lacking for women going through perimenopause in the healthcare system.
You absolutely can get pregnant and carry a healthy pregnancy during perimenopause.
I always hear the argument of like, oh, kidney stones, or like men trying to like somehow relate to the experience. I'm hearing this list and it's like, man, I don't have to deal with any of this stuff.
There's actually also 2 drugs now available that can help with women's libido that too few people know about.
Like what?
Whoa.
Oldish. The art of knowing more and caring less. With your hosts, Randy Spelling, Brian Austin Green, and Sharna Burgess.
Welcome back to another episode of Oldish, everybody. We have an amazing topic for you today, something that half the planet goes through, but pretty much nobody talks about. And the subject is menopause. And don't worry, this is
I don't talk about it much. I get it. I agree with you.
I'm 40 and I don't talk about it. And this is not going to be your grandma's hot flash menopause story. We have someone really amazing here to chat with us today about it. She is the author of the book Millennial Menopause, which I'm super excited to read. Her name is Lauren Tetenbaum, and she is a wonderful human that's going to, I think, enlighten me on so many things. So thank you for joining us here today, Lauren.
I'm excited to be enlightened as well. Thank you so much for joining us today. How are you doing?
Thank you for having me and for that beautiful introduction.
Of course. I think the best place to get started here, because even me, if someone asked me the question, I wouldn't quite know how to describe it, which is so embarrassing. I'm a woman that's 40 years old. What is menopause? Like, we know it as a basic, like,
I can
bullet
answer
point.
that. I'm not going to answer it,
No.
but I can answer that.
Stop it. You can answer it as a bullet point, right? Like on what is menopause. But truly,
Right.
what is menopause?
Yeah. Okay.
First of all, don't feel embarrassed. I also recently turned 40. And a year ago, when I was approaching 39, I said, what the F is menopause? Why doesn't anyone talk about it?
Yeah.
And I am a licensed clinical social worker specializing in women's reproductive mental health. I've always been really interested in women's rights, women's health, and I also knew nothing. And really, that's how the book came to be. I decided to look into it, kept asking questions, kept writing things down. And to answer your question of what is menopause, menopause is actually one day that marks 1 year of no periods, absent any other reason. And when we talk about menopause, we're actually usually talking about...
What? I'm sorry.
1 day of 1 year?
It's
I'm
one.
confused.
Yeah. It's wait.
One day, 1 year where there is no period.
Mm-hmm.
And then
It's like your anniversary.
You just made it sound too simple, Randy. I don't trust you and your.
But do you mean that then there's never a period again? Like it's that moment where
Correct.
she never
Once
returns?
you've reached menopause, you're always postmenopausal.
And it's a 1 day thing.
It sounds like, I mean, is it fair to say that most of what people talk about is perimenopause and the symptoms of perimenopause?
Wait,
Yes.
and then what is
These are not dumb
perimenopause?
questions.
I'm
Wait,
so confused.
so many questions. Okay, so then, so the good part is menopause. Is that when you get past all the symptoms, which we'll get back to?
Frequently. So the good part is you don't get a period anymore, which is a welcome change
it's not a
for
good
many
time.
women.
No, it's not a good time. Yeah.
Right. Some
Depends on
people
who
do
you
still
ask.
have hot flashes, but most of the symptoms do taper off in the years following that anniversary mark.
Okay, and to follow up on Bri's question, because yes, what is perimenopause?
Perimenopause is the period, no pun intended, but the period of time leading up to that last period and the 1 year anniversary.
Mm-hmm.
So it's just your phase of life where your hormones are fluctuating and you can experience all of these symptoms that we might know of as hot flashes, irritability, things like that. But yes, when we say I'm in menopause or she's menopausal, we're often talking about perimenopause.
That's so interesting. So yeah, when you hear someone talking about all the hot flashes and I'm going through menopause, it's like you're going through the things leading up to menopause.
So what would you say, like I would say the average age for that 1 day, 1 year that you talk about menopause is like your 50s, right? Mid 50s. But perimenopause can start when and go for how long?
So the average age in the US of menopause is 51 and a half. Okay. And perimenopause can last between 4 and 10 years and often starts in one's late 30s.
Aren't you glad you're not a woman?
Yes. For many reasons.
Just both of you right now. Yes. You don't go through none of this. A lifetime of periods and then this situation.
Just you wait till the room has to be 61 degrees.
Right.
And you're sitting there with a knit blanket shaking going, oh my gosh, what's happening?
Wait, you and I will just sit around talking about boxing and stuff like that while all this happens.
What do you think? I mean, well, obviously you were compelled to write Millennial Menopause. So let's talk about like the title there. How did that come about? Why millennial?
I'm very much a millennial girly. I was born in 1985, and I think our generation, so we are in this together.
I was like, me too.
You just pump the sky.
Sometimes I forget this is also people just listen, and I'll do hand gestures, but I'm raising my hand. I'm with you. You are my people.
Okay,
yes.
All right.
But I really do feel a connection to other millennials and zillennials, which is, the Gen X overlap. I think as a cohort, we do tend to talk about tough topics a little more easily than prior generations. And there has been a movement among Gen X women recently where they're talking about menopause, talking about access to care. But I've heard from every woman older than me, I wish I had known blah, blah, blah in my 30s and 40s. And I thought, I've got to tell everyone I know. I have to tell my clients, my friends, and I have to learn about it myself.
What is generally the thing that fills that blah, blah, blah space? What is the thing that people most want to know about, they wish they knew about in their 30s and 40s?
They wish they had known that whatever they were feeling was due to hormone fluctuations. It wasn't that they were going crazy or turning into a version of themselves that they didn't like. It was actually hormonal, biological, and that resources are available to help them through it.
Okay, so let's go there. Let's say that someone is, could be late 30s, early 40s, mid 40s. Where do you see perimenopause starting? What are some of the symptoms? What can people look out for?
So the basic answer is changes to one's menstrual cycle, but so many women don't get a period for a variety of reasons, whether they're on a birth control pill, they have an IUD, they don't have a uterus anymore. So aside from that, one of the most common symptoms that we see and too often dismiss are changes in one's mood or their cognitive functioning, a lot of brain fog, a lot of forgetting why they walked into the room, a lot of forgetting names of people and places that they know.
I'm going through menopause. That's exactly what's happening. 52.
You're going through menopause.
I'm at the age of it. Because I often walk into a room and I go, why the fuck did I walk in this room? God damn it.
Yeah.
It's exactly why. Okay.
Yeah. Wow. Okay. So I feel I actually felt those things from the minute I had a baby. And I think women describe it as, that's mom brain. And, you see those memes or reels on TikTok or Instagram of a woman, she just walks in and just freezes, just flat out freezes for like a good 10 seconds and then you kick back in. I feel like that happens to me all the time. Am I perimenopausal?
You might be. And I know we're joking around, but some of the symptoms can be rough, but help is available. So I want to make clear, if you are perimenopausal, that's okay. This is a normal, natural part of life. And if it's affecting your daily life and you don't like how it feels, we can talk about solutions to that. But I just want to point out that mom brain and perimenopausal brain are connected. And especially if you did have kids in your late 30s or early 40s, you actually might simultaneously be postpartum and perimenopausal.
Oh, that's delightful.
That's a good time.
A wonderful cocktail.
Is it because those two could be related? Is it the hormone fluctuation that relates them both?
Yes. So we know from too few studies, but we have them, that women's brains during pregnancy do change. And of course, then you have the biopsychosocial components of having a new baby, not getting enough sleep, life stressors, the potential for mood and anxiety disorders during that postpartum phase. And we see a lot of that again in perimenopause. And then, the double whammy if you have them simultaneously. But yes, there are estrogen receptors throughout our bodies. And the main function of menopause is that your ovaries stop functioning and producing estrogen.
Mm-hmm.
So when we have estrogen fluctuations and then eventually it tapers off, everything gets impacted.
I imagine you can obviously go to a doctor to have these things tested, and I have actually done that recently. But what are some of the things that we can do at home to monitor that as women? Say you hit your early 30s mid 30s, close to 40s, and you're like, I'm feeling a little bit this way. What can we test to know if we are heading into perimenopause?
So it's a lot of symptom tracking, whether you use an app, which, is a little tricky these days with data collection.
Yeah.
You could just use pen and paper and just write down how you're feeling each day. Different platforms offer kind of checklists that are helpful, but it's really important to know yourself. That's my main piece of advice. And know if anything feels different or changes. A lot of my clients say, I'm so angry all the time, and the tools that I used to use to regulate my emotions are no longer working. And that's different for them. And so something's different and changing, and then they can go to their doctor. You can get a blood test, and you should if that's what you want, but there's actually no diagnostic tool for perimenopause. It's a clinical diagnosis based on symptoms.
Is there anything preventatively that a woman can do, or is it just kind of a genetic, you're just sort of, you're in, and when it starts is when it starts?
So when it starts is when it starts. Your mother's timing is a good predictor, although not a guarantee. But what you can do is mitigate the severity of the symptoms through different medications or lifestyle changes.
And what are some of those medications and lifestyle changes?
Sure. So I'm not a doctor.
Yeah,
I'm a former lawyer, so I always, want to see why I there. But the main medication, the gold standard of treating menopausal symptoms is hormone therapy, which we often use the term hormone replacement therapy or HRT. Right. And for our generation, or really our mothers, they were essentially not offered that option because a big study came out in 2002 that really scared everybody into thinking that hormones were bad. It caused breast cancer. And in the 2 decades since, those findings have been clarified and debunked. And usually women are eligible for hormone therapy, but it's not offered as much as it should be. And that's sort of the movement in the healthcare space for change, because estrogen, progesterone, testosterone are really game changers for the symptoms that women in menopause are experiencing.
You said it's not really offered. What tell me more about that. Talk to me more about what is lacking for women going through perimenopause in the healthcare system. What are we not getting?
So unfortunately, because of that study, an entire generation of medical providers, doctors, nurse practitioners, et cetera, they weren't taught about menopause really at all, and certainly not about hormone therapy. So actually, Sharna, I'm curious, when you go to your doctor next time, I would encourage you to just ask, tell me more about menopause. Because when I've done it, I've been dismissed. My doctors have said, you don't need to worry about it. Or if you still got a period, it's not a thing that you have to think about. And I think doctors are great and have good intentions, but too many are not aware of the fact that hormones can be safe and effective, can be offered before that lack of period for a year. And a lot of doctors are still afraid of prescribing hormones. But fortunately, more and more are getting educated.
How would one go about finding someone that is educated in that or educating themselves? Because that's hard in a way of people have their GP or their practitioner who they've been going to, and to know they're probably not educated and can't help them in this space. I feel like I've heard stories of this. You know, they just told me it was nothing, don't worry, but in the process, I'm losing my mind. You know, so we feel gaslit a little bit as women when we go in with symptoms of things, not just menopause. So where is there a safe space for women to go to? Is there like, where can we go to know if our practitioner is right for us, or how do we determine that?
So, of course, read my book, Millennial Menopause, because I provide a ton of resources. I would start with the Menopause Society. It's the professional organization of healthcare providers, and they have a directory. They have resources that are free, that are amazing. And then in the book, I do also highlight a lot of wonderful healthcare providers who are providing free information on social media and providing a lot of education that's sorely needed.
Amazing.
Can I just say I'm shocked to hear that that a woman would go in to meet with a doctor, and that the first thing a doctor isn't doing is prescribing some sort of medication, because that seems to be there. It seems like that's always the first thing that somebody does is like, oh, you just take this. You know, and they're always trying to sell and make money. Yet with this, it's almost the opposite of that. Like, you have to chase down someone that will sell you something.
No, I'm sure they prescribe them antidepressants or anti-anxiety medication.
They sure do.
They heavily prescribe, but not for the thing that is actually going to help, the HRT. Oh no, you're suffering anxiety, not menopause.
Right. You're short-tempered. You're feeling all out of sorts. You're not sleeping well. Here's something for sleep.
Okay.
Here's something
so you
for
think
mood.
They're purposefully like misdiagnosing it a little bit just to get you on things that cost more to prescribe? Or I mean,
I'll let Lauren answer this. I personally, I don't know if it's.
I'm just curious. I
don't think that it's that nefarious. I just think we're having these conversations, whereas 10 years ago these conversations just weren't being had.
Mm-hmm.
And so I think there's just not enough education, kind of similar to what we talk about when you go in to a doctor and there's so little food education.
Mm-hmm.
There's so little nutrition education that it's more about symptoms and finding the cure for those symptoms versus root cause. And I think this is the same thing. There is root cause in a woman hitting this stage of life, but it's kind of nebulous because these symptoms aren't there's no real litmus test to say, okay, here's the stage that you're at in perimenopause.
Right.
And what's funny is men can get testosterone pretty easily.
Women can get testosterone. It got offered to me at some point that was like a pellet that they were going to put in my butt of getting like.
Don't do that.
Yeah.
Please don't do that.
I did it and it felt lovely. So I would suggest everyone.
Unless you're a woman.
But I think it's interesting between women and men because from bodybuilding back in the day, even now, but now I have many friends who I didn't realize, I'd catch up with someone from 2 years ago. And they're like, oh, I'm on TRT and I feel great and my libido and this and that. And they will get, I would always suggest people to get their blood panels to get their numbers to see, but there's such an epidemic now of testosterone being lowered. We can get into what's behind that, but men's testosterone levels are going down, fertility's going down. And now, there was levels where people were at like 800-900 for our age back when they were like 50, 60. Now men are in their 30s and their levels are at like 400, 300. And so, men will go to the doctor and say, I have low libido. I might be experiencing erectile dysfunction. I'm tired or depressed or all these things. And they'll be like, you should take testosterone. And they take testosterone and feel better. And then with women, it's like, it's harder to get. There's estradiol, there's estrogen, there's testosterone, there's all of these cocktails. And then it seems so much harder. So that whole diatribe to say,
No, but yes.
Yeah.
I knew he was
You're
going to
right.
know
Yeah,
more
I
about
know.
this than me. I knew it.
Should have
You
fucking
know.
bet money. I should have done it.
Lauren, this is why Randy's the professional out of the three of
Never
us.
bet
We just
against
tag
Randy
along.
Spelling.
We tag along and say stuff
I'm
sometimes.
still waiting to rapid fire quiz him. So
Yes.
so I guess my question is, thank you for writing this book. Thank you for, working with people and your clients to help them. Where does someone start on this journey? What is step 1, 2, and 3?
Sure. So I would say step 1 is know yourself. And don't be afraid to ask for help if you're experiencing symptoms, whether they're physical or physiological, you can get help. Then call a trusted provider. It can be a therapist like me. It can be a doctor who, at the very least, is willing to collaborate with you, research, refer out if they don't know the answer. And then step 3 is do whatever you need and want to do for yourself. It's a different experience for each woman. Some women who, for example, are actively treating breast cancer are not candidates for hormone therapy. Some women don't want to take it. If that's what they choose, that's their body, their choice. There are other lifestyle changes that one can make, like good sleep, proper nutrition, stress relief, connection with community, things like that. So I know I'm throwing a lot at you, but I really do, again, want to reiterate that it's a time of opportunity and help is available.
So you say some women will choose to not take it. What are some of the reasons women, or is it just this study from 2002, but what are some of the reasons that women choose to not take hormone therapy?
Most of the reasons, to my knowledge and experience and research, are fear-based. They think, well, I have a family history of breast cancer, so I'm not a candidate. That's actually incorrect. Yes, if you have a family history, you should get more monitoring, do the mammos, et cetera, which, we all should be doing anyway. But a family history is not a contraindication. Other reasons, some people just might not want to pursue medication. And again, if that's their choice, that's their choice. Some women don't have such severe symptoms, so that's great. We do know that estrogen is very protective of your heart and brain health. We see an increase of risk for Alzheimer's and dementia once women reach menopause. So again, the gold standard from the Menopause Society and other professional organizations is to take it, but it should be up to each woman.
I totally understand that. And I didn't realize that we see the higher rate of dementia, Alzheimer's, once menopause is hit because it's estrogen that protects the brain.
Yeah.
What are some of the gifts of perimenopause? Actually, before even asking, I want to hear the gifts of perimenopause, menopause, and postmenopause. Well, what would you say are the symptoms so people know what to look out for? Like, give us the whole buffet. And then also, what are the gifts? Because I feel like elders back in the day, there was a real, once you hit this certain stage, there's wisdom in it and there's something in it. So when we hear menopause, so much of the time it's like, oh my gosh, the hot flashes, the cold flashes, the irritability, the this, the that, without the positive of, hey, this is the stage of life. You are going to go through this, and here's what you get either from it or after it.
Yeah, no, and that's a beautiful way to frame it. We also know from research that when women do enter this phase with more optimism and without that sense of dread, that the way they experience it is better. If they're approaching it with negativity, they may be at risk of more severe symptoms. So I do encourage women to feel, at the very least, curious about this phase of life. The main gifts are that you no longer have to worry about being pregnant. You don't get your period anymore. And truly, as you just mentioned, women report all the time that they feel empowered, that they have less tolerance for bullshit, that they know themselves better. And I think we are moving towards that but we still have a very kind of ageist and sexist society. So that's why I wrote this book, so we can get past those old perceptions of what it means to be an aging woman.
Is there anything that changes as far as like a sex drive?
That's what I was
for a woman at that point?
Yes. So I want to answer Randy's questions of the main symptoms, and then I'll go into that.
Answer
so
the important ones
read
first, and then you'll get to my silly one afterwards. Got it.
No,
It's
I think
not
it's
silly
a very
at
important
all.
question.
Okay.
Yeah, it's not silly, but I actually, in my list, I end with that. So I'll
Okay.
just read a few.
Got it.
So the book is full of pop culture references, including 90210, I have to say. And so I start in one of the chapters. I say, okay, ready? Okay, bring it on. Symptoms may include low energy, feeling faint or dizzy, poor focus, brain fog, changes to sense of smell, changes in body odor, changes to one's allergens, changes to one's voice, sensitive gums, itchy mouth, burning mouth, headaches, ringing in the ears, cold flashes, itchy anus, heartburn, heart palpitations, chest pains, bloating, numbness, low libido. There's more, but I don't want to terrify people. So,
No, terrify me. Keep going, because I need to know.
Yeah.
Tell me.
not everyone experiences any or all of these, but there are things to look out for. And, people are very surprised to hear something like the ear ringing. But there's estrogen receptors in our ears, and when our estrogen is wildly fluctuating, that might show up.
Wow.
So other symptoms can include really bad PMS, rage, your periods change. They can be described as murder scenes, urinary incontinence. Yeah. And just to be clear, we're laughing with everyone,
Yes,
because you
we
have to
are.
laugh at some of
With
it.
everyone,
Right.
Lauren, I'm laughing at myself currently in this moment. This is just I feel so seen. I know it's so interesting though, because I know I just had everything tested for me recently because I want to have another baby, that I'm not perimenopausal yet, or at least I don't know now, because do doctors know? But I had all my eggs tested and we did the whole thing.
If they check your FSH levels and you should be, good that for carrying a pregnancy, then that's a good indication that you'll be okay. Of course,
It
nothing's
was
guaranteed.
said to me in so many words, you have nothing to worry about it. You're well far away from it. Everything's fine. She was like, probably mid-50s, you'll be hitting actual menopause. I was like, cool, we love this. Let's hope that's true. But I listened to the things that you're saying and I'm like, wow, I actually have so many of those anyway. And it's, I don't know if maybe it was wrong. Like maybe I am slowly starting to come into it. Or is it that now is the time for me to really pay attention to it and relieve stress? That's a joke. We have 4 kids. But to actually do what I can to, how? What do I do? How do I hold this off for as long as possible?
So take a deep breath.
Yep. I forget that sometimes.
Yeah. And I mean, I tell myself that too. I am a psychotherapist, but constantly using tools on myself as well to regulate my emotions. The general rule, if you're 35 or above as a woman, is to work with a reproductive endocrinologist when you're family planning, just to make sure all of your ducks are in a row. And you absolutely can get pregnant and carry a healthy pregnancy during perimenopause.
Yes.
Just so you know. I would just say, if you are feeling any or all or some of these symptoms, ask yourself if it's bothering you. Is this something that you want to work on with a healthcare provider? Maybe changes in your diet could help. And not for nothing, you have 4 kids, however many jobs, you're very busy, you're stressed, life can be difficult. So sometimes our stress and our environmental factors show up in our health too. And it's important to recognize when it's perimenopause so that you can get the care that you need. But you don't always have to parse out exactly what's what, as long as you're getting some help and feeling better.
Is there, you say there's no way to really, it happens when it happens, you can't necessarily delay it, but can you somehow trigger it to happen sooner?
So there is Some women do go through premature or early menopause, so either before 40 or before 45. That's often due to genetic conditions. And then we also have women who, when they get their ovaries removed, perhaps they have Lynch syndrome or some other kind of cancerous gene that they then mess around with their ovaries, and that can create induced menopause. And that can also happen during chemotherapy treatments or other kinds of treatments. So it's triggered that way. There's also research being conducted now that looks into adverse childhood experiences that maybe bring about earlier menopause or other forms of stress or trauma. So there's a lot we don't know, but that's being looked into.
Wow. So interesting.
Which is great that it's being looked into.
Yes.
To expand and enhance this conversation to just know more. In terms of menopause, right? Or in terms of being at this stage of life, how can partners help? Because I think a lot of times the partner just, could not understand. Let's say the partner is the opposite sex and they're like, I don't physiologically understand these changes. What can they do and how can they go about having conversations constructively?
I love this question so much. I've always had great guy friends. I have a brother, and I have my son is my oldest child. And I've always been very open about women's health with the men in my life. And I think that that's step one, that we have to be talking about it and not being ashamed of this natural bodily function or stage of development, much like I think we're getting a little more comfortable with periods, but I think there's room to improve there too. So talk about it, normalize it, ask your partner how they're feeling, ask if they want you to go with them to a doctor's appointment. Maybe do some research, maybe read my whole book. I have a chapter specifically dedicated to men in which I talk about issues like libido, which we can come back to. I didn't forget, Brian.
Okay. I was gonna stop you at some point. I was like, wait a second, come on now. We're talking
but yeah,
about
whatever
the
it is,
things
just
at the end
ask
of
your
all this.
partner, how are you doing? And so many of the women I researched or I interviewed for my book said that the men in their life noticed that they were not quite themselves and they were really there for them, whether they were brothers, husbands, friends. And they helped point out, hey, I think, something's going on. I think it's biological, and let's figure this out together.
Got it. So back to Brian's question then, how does sex appetite, actually having intercourse, what changes at this stage?
Both for perimenopause and menopause.
So during perimenopause, we often see libido dropping. And that can be attributed to a variety of things. Hormone changes. We also know, of course, that midlife, again, is stressful, right? You're raising kids. Maybe they're young. Maybe they're teenagers. Maybe your parents are elderly and you're taking care of them. Maybe your body's changed physically and you don't feel sexy anymore. So all of that can impact one's desire and libido and connection with themselves or their partners. And then we know that the drop in estrogen can really impact what they call the genitourinary symptoms, which relates to anything, quote unquote, down there, which I want to use proper terminology. But the vulva, the vagina, the urinary tract. Mm-hmm. And they used to say that women's experience vaginal atrophy, in which their vaginas basically shrink and the tissue dries up, and it can be really, really painful. They don't use that term anymore because it's kind of difficult to swallow.
Yeah.
Yeah. But the good news is that these symptoms are super treatable, the vaginal atrophy piece, with vaginal estrogen, which is very safe for all women, even if you have active breast cancer. So use vaginal estrogen. And then if you're in peri and still, not quite experiencing that level of difficulty, but still not feeling that libido, there's lots of things you can do, like couples therapy, like exploring different things that turn you on. And there's actually also 2 drugs now available that can help with women's libido that too few people know about.
Like what?
Whoa. Yeah.
What are
I've never
those?
heard of that.
I know. I didn't either. And it's crazy, right? So they're called Addy, which is a pill, and Vyleesi, which is an injection. Those are the brand names.
And they do what?
So they are meant to stimulate one's responsive desire. And it's not a slam dunk. You know, not everything works for everybody, but they're certainly worth asking your provider about.
So is it like a female Viagra kind of?
Yep.
Yeah.
It's called the little pink pill.
Well,
I've
it's about
heard of that
time,
before.
Lauren. It's about
The
time.
little pink pill.
That's amazing.
Yeah.
So essentially how Viagra, Cialis sort of stimulate blood flow, is that the idea? Is that this little pink pill stimulates blood flow to turn you on down there? Is that the idea?
Yes. And I would refer you to some of my wonderful colleagues who are sexual health medical
Or we'll
providers.
just put a
to
link
get
at
all
the bottom of the
biology.
page for this little pink
Little
pill.
pink pill. Buy it now.
Yeah.
Have you heard of this? Something I found interesting. This popped up on my social media. Don't ask me why these are popping up, but it's all these like,
Why?
stop
Why
it,
are
Brian.
these things
Brian, here we
popping
go.
up, Randy?
Here we go. Because I clicked on one of them once
Sure.
because
Sure you did.
listen, I do
Okay.
research. I need to know.
Yes.
There
Okay.
was a pill, I don't know what it was called, but it was stored, you know, like everything else in advertising. It was like, this didn't work for me, right? And this drug didn't work for me, but this one, and it was sort of like it had this drug, but the trifecta was oxytocin. It had oxytocin in it, and I was floored by this and actually very intrigued because the chemical that gets released when you feel connection, like when you hold a baby or you get turned on by someone, you're like, oh my gosh, that love chemical. This is in pill form, or I guess nose spray now that you can take, and it you get these like feel good chemicals, right?
Randy's been pushing this nose spray thing for
That
like 2
sounds-
months, and I didn't know why.
It's my side
Now I
hustle.
know. Yeah, totally.
Are they a
Sounds incredibly
sponsor?
dangerous and addictive.
It sounds dangerous and addictive.
Doesn't it? Like spraying oxytocin up your nose so you can feel good? Or did I miss something here?
Well, I think it's having to do with being turned on, because a lot of times just having blood flow, so let's say for men, right? I'm just going to use men, is that sometimes there is a problem down there, so it's blood flow related. Sometimes it has nothing to do with that. It's actually just being turned on, or it's lack of connection. So obviously this is where you would come in working with someone like you to help foster more connection. So there's less resentment and everything else that's going on. But also, you know, it's sort of this chemical. I don't know. I mean,
Yeah,
that's
no, I get it. Listen,
one of the big pillars of
Yeah.
what comes between couples. Am I right here?
No, I think you're absolutely right. And I appreciate too that yes, it's chemical, it's biological, but it's also that emotional connection and also the connection that a woman has with her own body, right?
Yeah.
If she's not feeling good about herself, she's not in the mood for sex.
Yeah, and I imagine feeling perimenopausal, you would feel much like your body is betraying you, you know, and if things are, for example, dry or whatever, you feel like it's not doing what you want it to do, or you're not functioning the way you want it to function. I imagine that to be really disheartening. And so that's not a libido kicker at all. You know, that's a not feeling like yourself.
Yep.
It's a really big thing.
Yeah.
I'm so glad that you're helping more women have this conversation and giving them education about it. Because I know just from relatives and friends that a cousin of mine who was suddenly like, you know what's been wrong? Perimenopausal. She was 39. She had no idea. She thought she was losing her mind, as so many women say. And doctors had said to her, you're fine, it's too soon, you're fine, you're fine. And finally the right doctor she went to was like, no, honey, you're perimenopausal. And it was a wonderful relief for her, but she's still going through that, my God, she can't stop it. So she's still trying to find her flow of like being in it and accepting it and being okay with it. And I think, again, thank you for having the conversation, writing the book and giving information to women to be able to understand what's happening and how to, I guess, start to work with it and within it. Because it really is scary.
Yes.
Finding
Thank
a
you for
diagnosis sometimes makes all the difference. Just understanding like, oh, what I'm going through is not just me being insane. Like there's really something happening.
It's validating.
Validating. Yeah.
Yeah. What were you going to say?
Yeah. And just knowing you're not alone in it. I totally agree. I see that all the time with my clients who are experiencing mood issues in the perinatal period. And when they hear that it's so common, they do feel better, right? And they know that it's treatable. And so being in community, talking about this, feeling less alone, feeling less overwhelmed, you already do hopefully feel better.
Wow.
Totally.
I have some quick fires, like myths and maybes that I would love to do with you, but some of them you've answered. So, but we'll do them just quickly. You can't get pregnant during perimenopause.
Yes, you can. So make sure
She already
you are
said
using.
you can. Yeah.
Menopause is just hot flashes and mood swings.
False.
False. It's so much more than that. You'll automatically gain weight during menopause or perimenopause, and there's nothing you can do about it.
You will probably gain weight. That's
not
things
the answer
you can
I was
do
going
about
for,
it.
Lauren. I was going for this being a myth. What is happening here? Okay, so you probably will.
But also, is it, maybe your body isn't meant to look like what it did when you were 20, right? And there's that piece of acceptance too. The main symptom is midsection weight gain, but again, hormone therapy can help. And of course, diet, exercise, and good sleep is key.
Good sleep is key. Well, I'm not ticking the boxes yet. I'm going to have to do some work.
I have a question before more rapid fire here, because you said that like maybe your body is meant to change and you're meant to gain weight. Yeah. And everything in me was putting myself in the woman who's going, but I don't like this. And everything I see on social media and everything I see on TV doesn't necessarily promote this. Yes, it's gotten better, but I think it's very hard in this society where everything is about longevity and looking young and feeling young to go, hey, it's okay to age and it's okay to, gain weight if I'm going to gain weight. Like, how would you work with a client who's coming to you saying, I feel anxious about this and I'm having a hard time?
Well, I wish I had a slam dunk answer. I think it's very much an uphill battle in our culture with this anti-aging emphasis, right? I would encourage self-compassion and kindness and say to women, I think health is best. Make sure you're getting the right nutrients from your food. Make sure you're active for so many reasons, including your physical appearance. But also live your life and find joy and try to work on that acceptance piece. And frankly, I would say that to any woman or man at any phase of life. It's not easy. I know it's hard, but I think it's worth pursuing because we've got to be happy, right?
Agreed.
I think that's the real work, is finding the acceptance and the grace in aging. I mean, our show is called Oldish.
Yeah.
But it really is finding some of these things, because look, as I'm looking in the mirror and my hair is turning gray and I'm watching things change and whatever, it's like, okay, that's new, that's different. And coming to peace with that. And I don't consider myself a vain person at all. And I know that if it stops me for a moment going, wow, that's a new line or whatever I'm seeing, it can be troublesome for a lot of people.
It can. I often think or try to remind myself that in so many ways, aging is a privilege. And I get reminded of that when I talk to friends who have lost loved ones or don't have their health. And I'm not trying to say that we all have to embrace being, older and gray or whatever, but I think it's important to remind yourself that it is such a privilege to keep going, right? And to keep finding joy however you can in your life.
Mm-hmm.
Yes.
Yeah, I feel like it's such a privilege to realize I've made it this far. Like I'm still here and I'm still doing well. And I'm still like taking really good care of myself. And now I'm in this fun part of my life where I get kind of the second act of it. And how long is it going to last? And what, you know, and I get to start being the person I am now compared to the first life where I spent half of it just figuring out who I was and trying to feel comfortable with myself. So I enjoy it. I really enjoy the aging part of it all. Like I don't look in the mirror and I laugh about it. Like when I'm having my hair cut and, you know, she's trimming the hair in my ears, or like I have the crazy like Gandalf, the eyebrow hairs now that come in where it's like, what's that one doing? I have no idea. That guy's just on his own journey. I embrace that. I think it's fun.
I'm not trying to rush menopause, but I'm certainly excited about the no periods and less bullshit situation that we've talked about. I'm thrilled that that's coming for me at some point. Yeah.
and I don't know, I'm just curious for any person listening going, why? Like, why are you excited to not have periods for someone who doesn't have a period and doesn't understand?
I think it's only someone with a penis asks that question.
Huh. Yeah.
You know
and for those who have a, that's who I'm asking for. Those who have a penis who are asking that question, I mean, to give them some understanding.
Anyone that's experienced a period will tell you, like, we all experience it differently, but it can be really hard on your body. You feel, honestly, so many of the symptoms that you're talking about with perimenopause, paired with you can have the back pain and the crazy cramps and all the while, what makes it so much harder is we are dismissed of, oh, it's just a period, go to work, you're fine. Whereas I guarantee you, if you were to actually know what it felt like.
Oh, we'd be laid out.
I was laughing to myself earlier when you were talking about all the symptoms and the things, thinking like, oh, men for years, I always hear the argument of like, oh, kidney stones are like the closest thing, you know, men trying to like somehow relate to the experience. And there's just I'm hearing this list and it's like, man, I don't have to deal with any of this stuff.
Yeah.
There's just no comparison.
There is a lot that our bodies go through. And to know that there isn't as much study, research, support, understanding, and empathy for it as there should be is also what makes it really hard to be a woman experiencing these things in the world. You still got to go to work. How long after a baby are women expected to go back to? After a C-section, there is just there is a massive gap and lack of empathy and understanding for women and what they experience, and which is why it's not just women that need to read your book. It is their partners. It is the men. They need to understand what it is that we go through.
It's why what you're doing is so important. I mean, education is the first step to all of it, and this is just. Nobody has spoken about this. I was so excited to have you on because it's a subject I literally have no idea about. It's where I know the stories. I know what you go through from the outside monthly, but I have no idea
what it
how
actually
it feels
like.
Yeah, there's an understanding and a knowing and maybe like an intellectualizing, and then there's a real curiosity, which is why I'm even asking those questions, because we won't know exactly what it's like, but to really understand it, to have empathy, because I think that is the first step of like, what is that like? I'm in a house full of women. I have a 14-year-old and a 12-year-old and a wife, so I am seeing it and understanding it firsthand, and I can really have a deeper appreciation for periods and what that is like and how it's so different for everyone and their experience of it. And hats off to you women for dealing with that. It is a giant cross to carry. That's sort of a bad way of putting it, but it really is it's
a huge responsibility.
It comes with a lot of stuff, but we can handle it. That's why we're the ones with it.
Well, there you go.
Snap.
Okay. Women 1, men 0. That's boy, that just put a mark
Go
on the
Sharna.
right there.
What other question do you have there?
Sorry, what were you saying, Lauren?
Just thank you for your allyship, because truly, I mean, yes, I think women are amazing and really powerful and can do a lot, but we shouldn't have to do it all alone. So, thank you to our brothers and partners and friends who are supporting us, whether it's at home, in the workplace, in funding the research, in policy. So thank you. It's very much appreciated.
Yeah, it's very much appreciated. And I think you're helping further that by helping people understand more of what it's like with your book. And I can't wait for more and more people to read it, for more and more men to read it, to understand women and to not be like, oh, she's got a period, or oh, she's perimenopausal, but to truly understand what that does to a body and to a person and to their mental health as well, that side of it. And it's really special and important. And again, we've said it so many times, but thank you. This is a really important conversation, and one that I had not been this deep in ever, other than people that I know and love sharing their experience of it, but not having the information that you've even just shared with us here. So it's so insightful. And while I joke and say I'm looking forward to not having a period, I'm still very cautious and like, oh my God, it's going to hit me at some point. Perimenopause is coming at some point. What's it going to be like for me? So the more I can be prepared in knowing and reading, and the more Brian can be prepared for it too, to have the support.
I
in the
need
home.
all the preparation I can get, I need all the help I can get for when it comes. So I can be the best partner that I can be in that situation.
Did your mom give any insight? Did she share anything with you about it?
She was in her late 40s. And she was a hot flashes, and those sorts of things. But at that time, my mum was also going through a hell of a lot at home with my dad. There were massive environmental factors that added to her experience of that. So it's
Got it.
hard to say.
There's a lot in there.
Hard to say what it really was that was going
Yeah.
on, but she had a lot going on, and she's an amazing human. 3 questions, Randy?
3 questions, Lauren. Are you ready?
I'm ready.
Okay.
Here comes the heat. Get ready.
So, what is one thing you used to care about deeply and are now grateful that you no longer do?
Other people's opinions of me.
There you go.
And I'm not immune, but I have really leaned into just being myself and kind of not giving a shit.
Yeah.
Was there a moment that you can remember that there was an awareness of that, of, you know what? I'm
I'm done.
I'm gonna make this decision.
Yeah.
I'm making this choice
I'm
regardless
done
of what
caring.
people think of me.
Becoming a mom really reset my priorities, and I am a much chiller mom than I am a person, but it has impacted me in a really beautiful way. And I think I just have felt more comfortable doing things that are in line with my values and not others' expectations.
Yes. All right. What's a messy human moment that taught you the most?
Oh my gosh. I mean, so many. Everyone has so many messes. That's a tough one, but I guess my husband and I were off and on in our 20s, and that taught me a lot. So I'm grateful that we came back together and all is good.
Yeah,
Love
you made
that.
it out of it.
There's hope. Yeah.
There's
We did.
absolutely hope.
Yeah. I think a lot of relationships, as I'm sure you see with your clients, as I see with mine, a lot of relationships go through fluctuations and ups and downs, and being able to know when it's time to end, know when it's time to stay together and work through it can be messy, but also powerful. Amazing.
Yeah.
And an opportunity to learn.
Yeah.
Yes, absolutely. Okay. What would you tell your younger self now that you know more and care less?
I would say don't take yourself so seriously. Life is more fun if you have fun with it.
Life is more fun if you have fun with it. It's so simple, but yeah. Like
I
it simply
always
is.
say now, like life is so much easier than I ever thought it was. Like I used to just grab it so tight and try and control so much of it. And it was just this uphill battle constantly. And as soon as I let go, I was like, all right, I know the things I have control over, and the things I don't, I'm just going to like relinquish any worry about them. It's amazing how much easier life has gotten. as it's gotten older, and it seems like it would be more complicated with all the things that I've lived through, and it's been the exact opposite.
I think that's one of the gifts of becoming old-ish and getting older is you through time, you learn lessons of, if I hold on as tight as I'm holding on, it's either going to kill me or it's going to destroy my relationships, or I'm just going to walk around anxious. So I can let go.
Yeah.
And that takes practice and support, but it's worth pursuing. And adding a little levity and silliness, I think, really helps a lot.
Lauren, thank you so much for joining us.
Amazing.
Please tell everyone where they can find you and your book.
So my book, Millennial Menopause, is available at all major booksellers. If you go to millennialmenopause.com, it'll bring you to my website. And I'm at the CounseLaur, Laur, on Instagram, my website, etc. And I will be on a book tour over the next year or so. I'm coming to LA.
Congratulations. That's amazing.
Oh, great. When are you coming to LA?
Thank you. I will be there July 20th if you guys want to come to my book party.
Okay.
Yeah, we're actually just
July 20th. Yeah, we're back.
We will be there for sure. That's amazing. I love that. Thank you.
Thank you.
And I want to say thank you to everyone who's tuning in and listening today. This was an incredible episode. So insightful. Lauren has definitely made it, I won't say easier, but I'm feeling much more calm about what is to come. And I know there is a place to educate myself even more. I really do encourage you to read the book, follow her even, and see those golden nuggets that she's going to share. The more information we have, the better. And of course, share it along to those of your friends that you think may be about to head into perimenopause or menopause, but also do not forget to send it to the men in your life that also need to understand what is happening with us, and we can help educate them on how to be the best support for us and to also not feel like there's something else going on and underlying. There truly is just a shift and change in our bodies. Really important, wonderful information. Again, please share this to everyone that you think may need it, want it, and would benefit from it. We appreciate you guys being here listening to us. Please like, follow, and subscribe. It helps us more than you know. It helps us bring incredible guests like Lauren, helps us continue bringing you great content that we do. We appreciate you being along this journey with us, and we'll see you on the next one.
I just wanted to take a moment to let you know that you don't have to navigate life alone. If there's something hard that you're dealing with or you're just ready for a change, then reach out to me at randyspelling.com, or you could DM me on Instagram, also at randyspelling. And if I can help you, I will. If there's a resource that I can share with you, I will also do that as well. Thanks.